Good evening, ladies and gentlemen, and welcome to Battling and Beating Cancer. On this show, we talk about cancer and awareness because early detection of cancer is very important. We provide you with knowledge and information about cancer because that is so important to defeating this enemy that we call cancer. And we also introduce you to some of the finest doctors so that you can take advantage of the world-class healthcare and treaters that we have right here in Chicago. And the other thing that we try and do is we try to entice everybody to get active and participate in the war against cancer by helping somebody who's battling the disease, by getting that information yourself, and by raising money for cancer research, because that ultimately is the ticket to all of our long-term survival. And we don't just talk at you, we talk with you, and we invite you to call in at 312-738-1060 and join with us here on Battling and Beating Cancer. On tonight's show, we have Dr. Katherine Griem, who's a radiologist, oncologist at Rush University Medical Center, and we're going to talk about radiology tonight. And a lot of our viewers have noticed that for a not very good-looking man, I always seem to surround myself with beautiful women. I have the three standards: Charlene, who I'll introduce in a moment, Dorothy and Christy, our fabulous executive producers, and our guest tonight, who you will meet in a moment or two. So Charlene, who is the co-founder of the Chicago Blood Cancer Foundation. She's a force to be reckoned with. She is the co-author of Battling and Beating Cancer, the Cancer Survival book, and she's my boss. Welcome, Charlene.
Welcome, and like I said many times before, this is the only time I get to get nice things said is on the air, so I'm glad I'm here today. So we did want to say that Dorothy and Chrissy are going to be on our last show, and we're going to introduce you to them. So I wanted to make sure we got that in there. We're going to talk about, like Scott said, radiation oncology tonight, but I want to tell you a little bit about our organization. Chicago Blood Cancer Foundation is a 503c organization committed to curing lymphoma, leukemia, and myeloma. We use the main weapons we have against cancer: knowledge, awareness, and raising money for research for better treatments, and ultimately the cure. So we invite you to contact us and join us if you are impacted by blood cancers, if you have a question that you don't want to ask on air, or if you have any ideas of upcoming shows, call us at 888-792-9992 or visit us at www.chicagobloodcancer.org. And tonight, our topic is, again, radiation therapy. Give us a call on Battling and Beating Cancer if you have a question, or if you'd like to ask the doctor, Dr. Griem, pronounced Griem, I'm sorry. Radiation is one of the traditional treatments for a variety of cancers, such as lymphomas, breast cancer, prostate cancer, and many other types of cancers. So it is another area with a lot of progress that has been made, better techniques to deliver larger doses of radiation to areas that you want to radiate, and better able to limit the radiation to surrounding areas. So when you are a cancer, and again, we'll go back to when Scott had his radiation, I think it was about the time they were doing the targeted 3D radiation, where they just zoom right in and they get right to, you know, years ago it used to be where radiation would just hit all your organs if you were doing like chest or something, but now it's kind of targeted. So they have a lot of advances. They've made a lot of advances in radiation. So the keys to our curing...
But before we do that, you know, my wife is the only woman of her kind. When she saw the program, there was a nice pretty printout of the areas that they were going to radiate. She didn't like it because she felt that it was giving too much radiation to my heart and lungs and other areas. So she actually went down to the basement of the hospital with the physicist and had them redesign the plan a little bit.
Well, I did, and that was because at the time, because you had surgery, which they didn't usually do for lymphoma, and you had surgery, and it was very controversial surgery, but normally they don't use surgery with lymphoma. But what they didn't have was studies of how much the more radiation, I guess it's the RAMs or something that they were going to give you. So I wanted to design it where it wasn't going to be extreme radiation and just do, the limited as far as, because there was no studies for it. So I was looking out for your health.
As you always do.
That's right. And I had to take control of things. But they did do a nice little radiation chart, and I had everything. I wanted to know exactly, and this is how you have to get involved. And I wanted to know exactly how much radiation was going to touch his heart, his lung, his liver. I wanted to know everything. So get involved when you're talking to your doctor. I mean, maybe I went a little too far, but that's just me. It was my husband and I.
Well, you just wanted to make sure if anybody killed me, it would be you.
That's right.
So it's time for your.
Don't say that on air. Now we have it on tape here.
For the keys to curing cancer
I would
segment.
never kill my husband. Let me tell you, I would never kill him. So. Anyway, let's go to let's get back let's get back on topic here. Okay, we're getting a little off topic here today. Keys to curing cancer segment tonight. A once of prevention is better than a pound of cure. I guess that's something Scott had made up. So one of the things you have to be, and again, cancer, we don't know where it comes from. Some of the things we do know a little, environmental, viruses, any cleaning products. I mean, they're looking more and more on doing a lot of research on chemicals, the environment, what we eat, what we take in our body. So a lot of cancers, and again, I'll go back to lymphoma. Lymphoma has been known to been caused by even viruses. I think the Epstein-Barr virus possibly was. They're looking at chemicals. And I even think Scott possibly may have gotten his even when a long time ago in his family, somebody did some carpeting and laying carpeting.
She's going off script.
Yeah, now. But anyway, it's just, I like to go off script. I feel more comfortable with that. But, so it could be chemicals in carpet, anything. So, and he may have been exposed to it. But these are things that we try to, scientists are working on and trying to find out. So, at that point, I'm going to just say a couple little things about our bike ride. And our bike ride is coming up on Sunday, September 12th. And the information is you can go to www.chicagobloodcancer.org. And you can also give us a call at 888-792-9992. And we want you to join our Out for Blood team. And pedal to cure blood cancer. So we want you can go up. It's online, and you can see it online at www.chicagobloodcancer.org. And it's Sunday, September 12th, and we hope you're out there and you join us. And at this point, I'm going to turn it back over to Scott, and he can introduce the doctor.
That sounds great. And while we trade places over here, let me just say thanks to the Chicago law firm of Meckler, Bulger, Tilson, Merrick, and Pearson. Obviously, it's through their support in part that makes this program possible. And boy, are we lucky today to have Dr. Kathy Griem with us. And you can tell our audience, they're very clairvoyant. They understand right away that you're brilliant. They see that you're beautiful. And I haven't even told them yet that you graduated from Harvard, I think I pronounced that right, medical school. And you are a radiation oncologist at Rush University Medical Center. You are very knowledgeable about radiation oncology, and we're going to talk about a lot of things. Welcome, Doctor, to Battling and Beating Cancer.
Thanks for having me on. Thanks very much.
So, radiology really plays a role through all aspects of cancer because you start out and it's a lot of the tools that we use to diagnose cancer and to see whether treatments are working or not are in the hands of radiologists, things like x-rays and CAT scans and mammography. Can you just talk briefly about the role of the radiologist tools in diagnosing cancer?
Sure, absolutely. So I'll talk first a little bit about radiology as it applies to diagnosing cancer. So radiology is extremely important in identifying individuals who may have cancer, in screening individuals who may be asymptomatic and have very early cancer. And then once the radiologist may have helped establish the diagnosis of cancer, then diagnostic radiology is very important in staging cancer, determining the extent of the disease, determining what areas of the body may be involved. So those areas can be monitored in terms of response to treatment, targeted appropriately for surgery or for radiation oncology. So radiology plays a very important role in managing cancer. It's also obviously the way we then monitor individuals who've been treated for cancer, monitor their response to treatment, and how effective we've been at curing their cancer. So very important in the management of cancer.
I think everybody knows what x-rays are, but people hear CAT scans or CT scans and PET scans and MRIs. Could you just briefly explain what they are and how they help in diagnosing cancer?
Well, CAT scans and MRI scans are both very refined tools that allow us to see in a greater detail sections of the body and cross-section. And those have been revolutionary in terms of allowing us to identify areas of the body that may be involved with cancer. MRI in particular is intriguing because it's a non-ionizing form of radiation and may be safer in certain situations, and also may be able to characterize areas of cancer more accurately. PET scans are, again, a revolutionary area, particularly as it relates to lymphoma. This is a functional tool that allows us to both characterize what part of the body is involved, but also the activity of the tumor. And that may help us, clinicians, distinguish whether something is a functionally active tumor or just an area of inactive scar tissue or something like that. So PET scan, revolutionary, particularly in the area of lymphoma.